I've had some kids make some pretty serious suicide attempts and not tell their parents.
When you are alone, it feels like all the walls are closing in and nothing's going your way.
There's two ways to take out these kinds of frustrations. There's depression and there's anger. And I was definitely the latter. I was definitely a very angry person.
Well, some of the statistics are very sobering. About 1 out of 5 kids are dealing with some type of mental health problem, and only a third of those kids are actually identified and receive treatment.
I think the overarching issue is that kids aren't talking about what's going on with them. So part of TeenHope's purpose is to encourage kids to be able to talk about what's happening.
I struggle with anxiety disorders, and I do see a counselor, so that seems to help a lot.
And sitting in a room with 100 kids and saying, there's a potential that 30 of you in here will develop depression at some point. Kids are so much more willing to go to the doctor if they have a cold than they are to talk to somebody if they have depression. And the issue around that, I believe, and when I ask kids, is the stigma. Part of TeenHope is a screening program.
If you have that screening and you realize that the person screening you can put you in touch with people who can help you, then you can get on that narrow road that's really difficult to stay on, but it's so rewarding in the end.
It allows a school district to build a culture that says, here in our schools, we address mental health issues. We will get help to kids who need it, and we'll get help to them at a price tag their families can afford.
We want kids to live big, full lives, and if they're living lives where they're small and afraid of being depressed, then it doesn't lead to them having a big life later on.